about the new it's a new handpiece for the existing machine. I think this is really very nice. It starts with the wrong part. This is really very nice about diamond technology I'm talking about. So if you already have the CRISTAL device, it's very nice. You just need to buy the applicator, which is not that expensive. So your return of investment will not be 6 months, but probably 2 weeks or 6 weeks. So this is very nice what it is about. Just a short repetition, I will run through these slides, but keep in mind that we have patients with structural problems, laxity and volume, and if we think about diamonds, we are addressing only patients with laxity issues because we can't treat anything more. Once again, laxity, we also have scales published, scales on that, and I think diamond, when we talk about this technology, is for sure something for grade 1 and 2. Nevertheless, if it's over the knees or on the thighs or buttocks or even on the belly, so it's for mild skin laxity but not for severe cases, depending on expectations. When you just think about the last patient with the tummy that Gina presented, we would probably say it's a bad result, but the patient was happy. So it's a lot about managing patient expectations. You probably can also treat more severe patients, but you should not. So for me, these 3 examples, that's not before and after, it's just 3 different ladies. These are the ideal candidates for me to be treated with diamond because they have mild laxity, they're not really obese or overweight, so that's the patient you should treat with. So the R&D team from DeLeo made a very nice move. So they took the CRISTAL machine, added a handpiece with high focus diodes on 940 nanometers, and used the aspiration, so the suction device from the cryolipolysis. So actually what they did, they took the same handpiece, but now they're not cooling, but some kind of heating. But they use the same technology for the suction, which is very precise with sensors, so that you cannot hurt the patients. And what you can do with diamond device, you can reduce cellulite. It's very hard to say that because it would be something like you can reduce wrinkles. So you can reduce laxity-related cellulite. You can do certain types of skin tightening and smoothing, and you can also do a little bit of contouring because these diodes both do some kind of neocollagenesis, but what they also do is they also address the fat tissue. So what you have a device which is just giving you energy with 940 nanometers, and at the same time you have the device is going to apply negative pressure to the tissue, so it's going to stretch the bands, and it's like a warm massage. I'm going to show you that. And the reason why they use 940 nanometers was the 940 nanometers can go deeply in the hypodermis. These selectively are also absorbed by fat tissues. At the same time you induce neocollagenesis, you also can address fat tissue and destroy fat tissue in a very delicate way, inducing adipocyte lysis, and it's well absorbed by water as well, which is very important for the heating, because by the absorption of water you increase the heat. You also have to measure the heat during the treatment, and this in the end induces collagen remodeling without leaving any necrosis. This is a small animation of how the handpiece looks like. So just imagine you have the CRISTAL device in here, you just plug in the new handpiece, and you have some handpiece which applies negative pressure to the patient, and at the same time and just giving the energy with the high focus diodes. So in the animation it looks like that you do a combination therapy with one handpiece. So we have been talking about combination therapies. You do a combination of stretching, massaging. What you do, you improve lymph drainage, you improve the vascular system, and at the same time you address heat, neocollagenesis, you reduce fat tissue. In a delicate way. The question is now, is it the miracle that you're going to have in your office? No, it's a very nice device to add on body contouring, and what is very nice about the device, it's also delegatable. So you can delegate it to one of your staff and you don't have to do it by yourself. So I'm going to, for patients with cellulite laxity degree 1 or 2, so for very mild cellulite. On first hand, you apply the negative pressure and the infrared heat to the tissue. You're going to massage and heat the tissue up to 43 to 45 degrees, which you can measure with this thermometer. And in the second part of the treatment, the whole treatment takes half an hour, you're going to reduce the diameter of the negative suction area, and you're going to make a more severe massage and stretching of the bands with diamond. So you just improve the lymphatic drainage, you improve blood circulation, and you just expand the bands, which also cause cellulite. You can adjust negative pressure also when the patient has more pain or less pain. So that's the adjustment you can do like with cryolipolysis. You apply some oil to the skin, which makes it like moving, and you have to move the handpiece all the time because otherwise it really gets stuck because the negative pressure is so high and it really gets stuck on the tissue. You should repeat the treatment 6 times at the beginning every second day. So basically it takes you 14 days to 16 days to do the first treatment session. After 2 to 3 months, you're going to repeat it once or twice to just maintain the even surface or just to maintain the blood circulation and the lymph drainage. And how it exactly looks, you're going to see right now. So let's go on. What you see here is the versatility of the device. So you have 3 different adapters. So depending, once again, on the severity, on the laxity of the tissue envelope, you choose the right adapter. The smaller that diameter gets, the more aggressive the same suction pressure will be applied to the tissue. And this makes it possible that you can treat the belly, the thighs, a lot of areas with that. So it's very versatile in terms of areas you can treat: arms, abdomen, flanks, saddlebags, thighs, calves, all the areas you want to address due to mild laxity. The question is, who is the right patient? I think I showed you before, it's a patient with mild laxity. I think it's more a little bit of the probably, I wouldn't call it the younger generation, but patients who still have nice tissue quality all over, because if you have very weak tissue, the effect will be less. You don't have any downtime, it's only 30 minutes. You repeat it in 6 to 8 sessions, and the session frequency should be something like 2 to 3 days. Currently we do 3 days because patients feel really a little bit some kind of a pain. They feel that something has been done. So that's the reason why we expanded to 72 days. These, once again, are the patients I would recommend to treat. And once again, you will have happy patients if you tell them you can improve the blood circulation, you can improve laxity on a slight way, but it won't be the surgery, something besides surgery. So the expected results, you can see 2 to 4 weeks after the last session. So when the patient starts, 2 weeks, all the sessions. After 6 weeks, all in all, she will see the first results. It induces neocollagenesis. It's improving the orange peel appearance, and in the end, it's also improving the skin tightening. These are some pictures, not from me, it's from the Leo. We are just about to produce our own before and afters. There's another picture that you've been seeing. So the take home with me with that device is it's a safe treatment. I think this is very important nowadays, especially when we have the expectations of non-surgical body contouring. It has to be safer somehow. In combination with CRISTAL, so if you have the device, you just have to buy the handpiece, because the return of invest, if you have the device, the CRISTAL already, will be 6 weeks in my hands. You don't have any disposables, which is also nice when we think about other machines. And it's very nice because the repeating treatments keep patients coming back to your office. So probably there are some side effects that you do some upselling or cross-selling. If patients just frequently come to your office, you also increase patient retention. And what is very important for me, that it's delegable procedure. So when I'm standing here, my assistants in Vienna can still do diamond and cryolipolysis, and this nowadays is very important. So thank you very much for your attention. I think, Gina, let's come up to stage, or if there's any more questions. Any questions from your audience? Yes, please.
Thank you very much for your both presentations. I wanted to exactly understand if the repeating of the sessions is like maximum 2 per area, and then after how many years, when you say it's according to lifestyle, etc., how many years after are you allowed it to repeat treatment?
Yes. Cryo or diamond?
Cryo, sorry. Yeah, what cryo?
I sort of stumbled across a couple of studies. One of them it's very hard to pretty much, you know, do it if it's unilateral area was treated. So it was a study, it was a case study of 4 patients, and they found 3 to 5 years basically, you know, persistent reduction with stable weight. So I would say, you know, it's permanent reduction.
Yes, for sure, but I think I would be a little bit cautious also to treat the same region once again frequently, because what we know during aging process, the deep fat layers get bigger and the superficial fat layers get smaller, and the thinner you have your superficial fat layers, the more saggy skin appearance you will have. So in my practice, I probably repeated the same area 4 times. So 4 times, so like I do two procedures at once with a gap of 4 weeks, and I repeated this session after 1 year once again. But I think just because the patient, it's rare that I do that, but just because of patients who have very tight tissue, so sometimes in the flanks for men, for example, you just touch the tissue and you just feel it's a very lot of connective tissue, and these patients you probably could treat more. For example, inner thighs, I would do 2 sessions and then leave it, because you could run into the problem to improve skin laxity, steady skin.
So usually in our consultation, what we communicate to the patient is that they will do maximum 2, and then we will see like from next year or the other, not more than 2 at the beginning, right? 2 sessions in the same area, not more than 2.
Yeah.
Okay. And
It just, you have to be careful of the skin again, skin laxity. I haven't seen again any literatures about you know, how beneficial it is to be the treatment, but it is common sense. If someone have, you know, with the caliber, you know, bigger fold, you probably can treat 2 to 3, but you will sort of get stumbled with the skin laxity. It depends on the affinity as well. Like you're a plastic surgeon and you find some you do liposuction and the skin is actually quite nice and tight, and some will have issues. Yeah, so 2 to 3 treatment maximum for the same area. That's what I would.
And one more question, if I may. How many areas can you treat in the same day or in the arch of 2 days? If a patient says, I want to come today and tomorrow and to do some treatments, what would be the maximum of the areas that you would be allowed to do?
So I treat maximum 4 applicators. So it's 2 areas. So it's, for example, it's inner thighs and flanks maximum. Because I don't know the science behind, but as you introduce apoptosis, the liver will somehow need to work on that, and I wouldn't do them more than 2 areas per day or per session. Even I would wait another 4 weeks to do other areas. So I would expect two areas, 4 weeks, nothing. Usually after 4 weeks I do a second treatment with CRISTAL, but I wouldn't go for 3 more areas in 1 session.
Thank you very much.
I think if you have the treatment yourself, I had it. It is actually very, you know, it's not very comfortable, but it is very well tolerated. But but pretty much after 2, you had enough. You want to. Yes, I don't think anyone will take more than 2.
Thank you very much.
So, one more question. The only symposium which is on time, I guess, yeah.
Thank you for your presentation, and I'm Gina from South Korea. It's the same name as you. And I'm just wondering, the full treatment is possible according to your presentation. So, which part of body are you recommending? Same time with 4 applicators. Which part of body?
It depends on your assessment. So for example, you probably can do lower abdomen and use amethyst for the saddlebags. Be careful of it. So it depends on what you need to treat, and that's your consultation. It also depends on the patient position. You know, gravity is important. It's a very nice ergonomic machine, but at the end of the day, and this is even my personal experience, sometimes, for example, you need to do here and there, patient lying this side, and unfortunately, to do the other side, you have to get them to lie on this side. And especially if they don't have too much fold, the applicator can, and they have the fibrous, fat, it can come off easier. So lots of factors. Which area you want to treat? Can you practically do it? That's another question.
Thank you so much for that. And just one more question. I know it's lunchtime. How many sessions one patient can do for a day? Maximum. How many treatment?
I think that was the question before. So we recommend 2 sessions, so 2 different areas per day. If you use the CRISTAL Pro, for example, right now, and you're able to do the arms and the inner thighs in the same session, it's done. So it's 4 applicators or 2 sessions in a day. And I think the problem with the 4 applicators is it's impossible to do flanks and abdomen or belly in the same way because pro and supine. So the limit, I think, using 4 applicators is just the positioning of the patient. That's the main limit for it.
Okay, thank you for that.
Any more questions?
You can also speak up like that with a small group.
I'm sure there's some male patients who have tummy, but they're not flabby and they're quite firm and round. And usually, like when you do CRISTAL, it may not suck so efficiently. What do you recommend for that kind of patients?
Once again, it's not about the machine, I think, but it's the assessment. I don't have my laptop with me, but I can show you on my cell phone some pictures, some graphs that I'm going to show this patient. You're dealing with intra-abdominal fat. So you're dealing with a mass of fat tissue which is behind the muscle. So there's no device in the market to treat that. And you have to tell the patient this is the very dangerous fat tissue that you have because it's on your intestine. So with males, I have probably the highest dropout rate in consultation of males looking for cryolipolysis on their belly because they all look like this. Do cryolipolysis, but in the end, the fat tissue is nothing. It's just the intra-abdominal fat. And you also see that with women after menopause, you also sometimes have the change that they have just like a blown up belly and they're looking for some non-surgical solution, but it's not the subcutaneous fat layer. So I would exclude these patients totally. There are no devices in the market to treat.
Okay, thank you.
So that's part of your assessment to start with, which I probably should have mentioned in my presentation. Cryolipolysis is for subcutaneous fat, which you should be able to pinch. You can't pinch, you probably cannot do, if you know what I mean, unless it's a very hard fibrous fat. So if it's a visceral fat and have the bear shaped tummy, it would do nothing.
Okay,
Yeah.
thank you.
One question about the diamond applicator. You said you're comfortable with your colleagues at the office to work while you're away. Since it's a heating device and it's from the lasers background, it's a wavelength that could depend upon skin type, phototype. How dangerous is it? Cause any burns, any high temperatures, or how safe?
Very good question. The physician who is doing that, she does laser treatments for the last 16 years. She's very experienced, and my wife is also a doctor, and she's working in office at the same time. But I'm totally agree with you. I think the limit with diamond is the negative pressure. What patients say, tell us during the procedure that the negative pressure sometimes really a little bit starts hurting. So before you start burning them, because the only way to burn them is to stop moving and leave the applicator on one place, because otherwise you cannot burn them. You can accumulate heat, but the main problem is if you stop rotating the applicator after 1 second, she will say stop it, because the negative pressure will be so aggressive that she's not able to take it anymore. What you do, and what I didn't show in a small video, you need to see a longer video. During that, there's a protocol that you start moving all the areas, you stop, and you measure the temperature of the skin, and it shouldn't be a lot more than above 42 degrees. So I'm totally with you. There is a problem, and I think there's so many devices out, you still can hurt patients, but the limit or the good thing about it, what makes it safe, you cannot burn them, but you will hurt them by the excess negative pressures as soon as you stop moving the device. Even if you start move it slower, it hurts because of the negative pressure. So that's some kind of a safety belt before you burn. But definitely, I'm with you. Yes, it could be dangerous.
And regarding the time, how much time you have to maintain this temperature? Is it
So it's
fixed or?
once again, this could be a long talk because it's upon severity, upon age, upon laxity grade. So when nowadays what we do is I give you a recommendation. Yes, the company says 30 minutes, 15 minutes per time, and you should maintain the temperature for 10 minutes. That's a protocol. But actually, these protocols nowadays are ridiculous because we have to customize it upon severity. But that's the normal protocol that we have for the usual patient. But if you have patients with a more severe laxity, for sure we're going to expand the treatment time because we need to apply more heat. If we expand the treatment time, we have to be aware by measuring the temperature that we don't heat up, that we don't going to heat up more, but we just expand the time of heat.
So do you believe that with the diamond there is a little bit of apoptosis as well? So you would get some fat destruction?
I think it's so little that it's hard to measure. We see how do we measure nowadays? There are some, we do it with ultrasound, with MRI studies, so it's really hard to measure that you destroy fat. And I think with diamonds, the main issue is not to destroy fat, but to improve lymphatic drainage. That's the main thing what you do. So I think diamond from in our office could also be a treatment that you offer after some certain time after liposuction. So for me it's an add-on. It's an add-on treatment, and for sure it's not a standalone procedure to reduce fat, because I think it's hard to measure and it's not enough. That's not what the device is meant to be.
Any other question?
So thank you very much. I think there are no further questions. Wish you have a good lunch and probably see you at the booth later on. Thank you.